Hi class. Today I'm going to talk to you about Alzheimer's disease. Alzheimer's disease involves the parts of the brain that control thoughts, memories, and language. It begins with mild memory loss and can lead to difficulty interacting with family, friends, and others involved in the individual's life. People diagnosed with Alzheimer's may experience issues completing everyday tasks such as cooking, taking medicine, or doing laundry. The greatest known risk for Alzheimer's is age. The majority of people diagnosed with the disease are over the age of 65. People younger than 65 can also be affected. This is known as early onset Alzheimer's. 5 million Americans are living with Alzheimer's, and it's projected that by 2050, the number of patients could triple without effective treatment. In 2018, it was estimated that 5.7 million Americans were living with Alzheimer's. 1 in 10 people aged 65 and older have the disease. The percentage of people living with Alzheimer's increases with age. 3% of people aged 65 to 74, 17% of people aged 75 to 84, and 32% of people 85 and older have Alzheimer's disease. Difficulty learning new information is the most common early symptom. Symptoms severely increase as Alzheimer's advances. Symptoms include disorientation, mood and behavior changes, deepening confusion about events, time, and place, unfounded suspicions about family, friends, and professional caregivers, more serious memory loss and behavior changes, and difficulty speaking, swallowing, and walking. Alzheimer's can lead to language impairments that vary in severity depending on the stage of the disease. In the early phase, speech is usually fluent, but the individual may have difficulties finding the right words to use. This can lead to isolation and result in anxiety and depression. The middle phase typically lasts the longest, between 2 to 10 years. The individual is not able to remember thoughts or express their words. They are not able to appropriately react to questions and have trouble understanding what is going on in a conversation. Disorders of attention and a decrease in verbal, mathematical, reading, and writing skills may occur. The individual may feel confused in familiar and unfamiliar settings. Delusions and hallucinations are not uncommon. In the late phase, memory is impaired, but it can be recalled with the help of photos. Communication is difficult. Judgment, logical reasoning, and social skills are severely impacted. This phase can last from 1 to 3 years. Although there is no known cure for Alzheimer's disease, there are resources available to help maintain mental function, manage behavioral symptoms, and slow down or delay overall symptoms. Here is a list of various medications that can help ease and maintain the symptoms of Alzheimer's. It's important to remember that there is no known cure. The Alzheimer's Association is a wonderful resource to use if you are trying to locate support groups in your community, local resources, and educational programs. They have a 24/7 hotline that is free and confidential, and anybody can call, whether they are the individual with Alzheimer's, a family member, a friend, or a caregiver.